Hello, thank you for joining us. I'm your host, Leah Love, and this is Forum 360, where we have a global outlook from a local view. Today, I'm so excited. We have our guest, Dr. Leslee McElrath, and she is going to talk to us today about hormone health. So thank you and welcome.
Thank you for having me.
So tell me a little bit about your background in this area.
Okay, so in the area of hormone health or just life general?
Oh, love it.
Okay. So I'm a family medicine doctor. I have a medical practice in Fairlawn, direct primary care concierge, and I got into hormone health honestly by accident. When I went through training, hormones were considered bad, and they call this cancer, and this is terrible. And someone asked me to learn how to do testosterone injections for men. And I knew that was something that I wasn't interested in because of the side effects from it. But I had a friend who was working with the company BioT, and she had tried to talk to me about it months ago. And I reached out to her to learn more and realized that my understanding of the research was very poor. That research had continued since I'd been in training, and a lot of the things that I thought I knew about hormone health was actually incorrect. And so I started doing more research. I connected with the company, and now I provide alternatives for hormone health because, yeah, these are things that we need that our body no longer wants to make in adequate amounts. And you don't have to feel terrible just because you're getting older.
Okay, so when you say hormone health, it sounds like a very broad, right?
Yes.
So putting it in layman's terms so everyone can understand.
Okay, so we're looking at testosterone, estrogen, and thyroid specifically. I do a little functional medicine where I can look at the adrenals and things, but specifically I work with testosterone, estrogen, and thyroid hormone. Thyroid hormone is necessary for metabolism. I'm kind of baseline explaining this, but thyroid hormone is really important for metabolism. The estrogen, like every woman knows that they have estrogen in their body, but what a lot of women don't realize is that we actually have more testosterone in our body than we do estrogen. And we need more testosterone in our body. Not nearly as much as men need, but more than the estrogen that we have. And as we age, it's about in the mid-20s that our testosterone level starts to drop. And that's why a lot of women, if you ask them, like, hey, when did you feel your best? It was in their 20s, when their testosterone level was high, when they, had the courage of their conviction and, they didn't fear anything. It was because their testosterone was higher. And so what we do is we are replacing it. So it's not a situation of forcing your body to make something it doesn't want to make anymore. We are just replacing it. Because you need it, your body doesn't want to make it. And so we're just giving it what it needs.
Okay, now typically, I know I've heard hormone replacement therapy with hysterectomies after menopause, things like that. So this is what this is good for, correct?
Well, it's good for that for sure, but also just women in their late 20s, early 30s that still have their ovaries, that are still menstruating. Again, the lowering of the testosterone happens way earlier than the experience of menopause, which is the lowering of the estrogen level, or how your body experiences the lowering of the estrogen level. And so, yeah, people in their 30s and 40s can benefit from having their hormones checked and having this replacement therapy if you have the vague symptoms that are suggestive that your hormones might be out of balance.
Glad you said that. I was just about to ask you, what are some of the symptoms or signs that someone would be looking for to say, oh, maybe I should go contact you?
Fatigue, no matter how much rest you get. Depression, kind of really out of nowhere for no reason. Brain fog, that sense that I know this word and I just can't get it. Poor concentration. A lot of those things that with traditional medicine we treat with, SSRIs and amphetamines and things of that sort can just be a hormone imbalance. And once we get your hormone levels to where they're supposed to be, those things are alleviated.
Okay.
For a time.
For a time.
Yeah.
So walk me through the process when somebody is contacting you, what they would expect when they come in, that full kind of customer service process?
Okay. So I have everything set up on my website so you can schedule your own appointment. So you basically tell me, hey, I want to be seen at this time on this day. You come in and we sit down and I answer all the questions that you might have about hormones. I have you, if you've not already gone through the online questionnaire, I have you do an in-person questionnaire. And it's basically, do you have these symptoms? Hot flashes, night sweats, fatigue, all of those kind of vague symptoms. Some of them are specific to menopause, but a lot of them are just kind of vague symptoms that anybody can have at any given time. And then I answer all your questions, and then we do labs. The labs, I work with LabCorp for the labs. Usually it takes me about 2 days to get the results back, and then from there we can schedule the appointment for the procedure if you're up to it. Now, what I always tell people is, do your own research. The website of the company that I use has lots and lots of information. So I tell people, do your own research, ask me all the questions you can think of, because once I do the procedure, can't take them out. They're there for the 3 months to 4 months that it takes for them to be absorbed into your body. So I want you to be sure that this is something that you want to do. This is an elective procedure. It's not something that's covered by your insurance. And so you're making the decision that I want to try this out. And I make no guarantees that it's going to work for anybody, but I do try to set expectations correctly.
Okay. And you said procedure. So explain what that actually is.
Okay, so it's literally a procedure. So there are the testosterone and estrogen are separated into little pellets that are bound with stearic acid, and that's all that's in there. These are bioidentical hormones, so they are plant-based, but the hormone structure is identical to what your body naturally makes. The company that I get the hormones from uses they use soy. And there's no soy in it, so there's even people that have really bad soy allergies don't have any reaction to them. But for some reason, humans and soy make the same hormones. I couldn't explain that if I wanted to. But so they pull that hormone structure out of the soy and bind it with stearic acid so that it holds its shape. And that's what gets inserted into the subcutaneous, or the kind of top fat layer in the back of kind of in your buttocks, kind of upper hip area. Basically, so that you don't mess with it.
So I know people are gonna say, does it hurt?
So you're numb. Yeah, you're numbed. It depends on how much cushion you have back there. If you're actually gonna feel it, how deeply I'm able to lay the pellets. But you get, for women, it's about a 3 millimeter incision. For men, it's a 4 millimeter. So it's small enough that you don't even need a stitch. Mm-hmm. We just pull the skin together, hold it together with steri strips to just kind of, because the body wants to heal itself. It wants to be whole. So if you just pull the sides together, the body will sort of knit itself together. But you're numbed, you don't feel it. Every so often people have some discomfort afterwards. Take some ibuprofen, it's really not that big of a deal. If it's laid a little higher on the surface of the skin, you can feel where the pellet is until it completely dissolves.
Okay. How long does it take to dissolve?
Usually it's about 6 months, and so we kind of alternate sides for women. Men, it's a little bit longer. But every time we do the procedure, we alternate to the other side to allow the body to completely heal that side, break down any scar tissue that's over there and things of that sort.
Now, is this something that they would do continuously, or is it more like until we get it balanced and then you're good to go?
No. So again, this is not the idea that we are causing the body to make something that it doesn't want to make anymore. We are genuinely replacing it. So you are doing this for women, it's usually about 3 to 4 months. For men, it's 5 to 6 months. Mm-hmm. You're doing it every 3 to 4 months until you decide you don't want to do it anymore. And that's perfectly fine. Like, it's not something where if you stop doing it, you are worse off. Right. You basically kind of go back to where you were, or if you're on it for a longer period of time, where you would have been had you never started it.
Okay, that's good to know. You mentioned BioTE. Why did you choose that company?
Okay. A couple of very simplistic reasons. One is that was the company that my friend told me about, because that was what she was using. But two, after I actually learned about them, there are other companies, I don't know the names of them, but there are other companies that provide you with the training and provide you with the access to the hormones and things of that sort. But BioTE, what I love about that company is part of their business model is, getting you a mentor that's been doing this longer than you have, so that when complications happen, because complications will happen with anytime somebody cuts you, there's a risk of infection, there's a risk of complication. And so having someone that's been doing this for years, or actually years, it's usually they don't have somebody that's not been doing this for a good long time before they ask them to be a mentor. But having somebody that you can contact and say, like, hey, this is what I'm going through, what do you think? Or having somebody that you can reach out to about labs is really comforting, because then it's not just me figuring this out on my own. I have somebody, because the company teaches you, and they're constantly doing research, and they're doing continuing education about the product, and about the supplements that they recommend, and about the history and everything like that. They're constantly doing research and providing information for us. But honestly, the big thing for me, and why I got with this company and plan to stay with this company as long as they're around, is the mentorship. Is I have a BioT rep that I can reach out to and ask questions of, and I'm not just out here on my own figuring things out or pretending like I know stuff. I'm very transparent with my patients when I don't know something and when I'm going to look up something, and having them as a resource is really, really awesome.
And I think that's very important, because a lot of people, you can tell when someone is just like, oh yeah, let me make up this answer really quick. And you're like, this is too serious of a process to just kind of wing it along.
Yeah.
So I love that you have that expertise and continued expertise in education. Can you tell us about all of the services that you do offer and provide? I know you have a lot.
I do a lot of things. So my medical practice is called Monarch Ideal Care, and I'm a direct primary care concierge family medicine physician. So that's a lot of words that basically mean I'm the doctor in your back pocket. I am that first line step when something's going wrong, when you just need a physical, like things of that sort. But my whole focus when building my practice is wellness. It's about prevention, and that's what medicine should be about. I feel like hopefully at some point it used to be about that. Nowadays, it's all reactionary. A lot of people just wait until things happen and then go to the doctor, whereas with my patients, I want to teach you that your body has the ability to heal itself. You have to learn how to listen to what your body is telling you and then give it what it needs. And sometimes it takes an expert to tell you, like, hey, yeah, based upon these symptoms, this is the way you should go. I'm also an IIN nutrition health coach. So that's really about accountability. That's how I use it with patients. And for some people, just having to talk to a doctor every 2 weeks about what's going on in their life, what's going on in their diet, is enough to spur change. Most of the time, especially when it comes to diet and exercise and things, nobody needs to tell you what you need to do, but there are things that are blocking you from doing it, and that's what I'm good at helping you figure out, and then how to make plans so that we can overcome those obstacles. And then, with my practice, it's all about wellness. So I've partnered with health professionals that are different than most primary care doctors would ever connect with. I've got a mental health counselor and a yoga instructor, a personal trainer, and a massage therapist, because I believe that wellness, true wellness, is about mind, body, and spirit. It's not just about, oh, well, I'm taking my meds every day and my blood pressure is controlled. It's, am I dealing with childhood trauma? Am I relaxing properly? Am I able to ground myself when the world goes crazy? Because it does constantly. We know this from COVID. Am I able to deal with these stressors? Am I exercising properly so that I'm not injuring myself, but I'm getting all the benefits? And then, I can go see my doctor. I always feel like I'm an afterthought, because done properly, wellness, my patients shouldn't need me very often. Yeah. Like if I do my job right, you don't need me as often.
Understandable. And if you are just tuning in, I'm your host, Leah Love, and we are talking to Dr. Leslee McElrath about hormone health. So, getting back to the hormones, what are some pros and cons of this procedure?
Pros are you feel better. I remember when I got my labs done the first time and saw how low they were, and it was like, oh, that makes sense why I feel kind of like trash all the time. That's great. And I got the procedure done myself. I never offer anything in my office that I don't do personally or if it's something that I don't meet the criteria for, that I'm not given away free to try out before I recommend it, because this stuff costs too much money to maybe hope that it does something. But when I did the testosterone, I only need testosterone therapy. When I did it and it kicked in, it was like night and day. I remembered how I felt when I was in my 20s, when I was in high school, when I didn't care what anybody thought about me, in a good way. And I had the energy to do stuff, and I had the focus to get things done, and it was amazing. Now, there are side effects, and they're relatively low, and everybody's experience with them are different. Some of the common ones are the pellet coming out and not actually being absorbed by your body. Because what the body normally does with these is it builds a bed of blood vessels around it to absorb it, to utilize the hormone out of it. And because it's bioidentical, it doesn't have to pass through the liver first, and so you don't have those side effects. But if the body decides, this is foreign and I don't want this in here, it will push it out. And so then you won't get the benefit of those hormones. Anytime someone cuts you, there's the risk of infection and the consequences of having an infection in your body. Hair loss. I've got a couple of ladies that have experienced some male pattern baldness. It's usually more genetic, but having that extra testosterone can increase the likelihood of that. Hair growth. So you can, if you are prone to growing chin hairs or a mustache, it might worsen that. And most people most women do like laser hair removal or shave or things of that sort, because the benefits outweigh the risk for them. Trying to think of other side effects. Like most people that have done this procedure with me, so I can only speak to those people, love it and stay on it. The only thing that stops them is usually the cost, because it's not something that's covered by insurance, which that's a whole different argument and conversation. But because of that, that's usually the only reason why anyone stops it. Like the way you feel when you're on it is amazing, and coming off of it, you just kind of go back to feeling like you did before. And for some people, that's not terrible. I've had people that have done it once and they're like, this isn't for me. Because like I said, I can't guarantee that it's going to work. I can't guarantee that it's going to fix the problem that you want it to fix. And what I always try to tell people, especially women, because we want everything all at once, everything, is that the body will use the hormones where it wants to use them. We cannot dictate where it uses them. So, like I said, my friend was the one, she's a physician in Texas. She was the one that told me about it. And she was excited because she started losing weight. Now, the hormones themselves don't cause her to lose weight. They gave her the energy to exercise. When you exercise more, you tend to naturally want to eat better, and then it's the snowball effect. Well, I was like, well, I want that. I want to lose weight. That sounds amazing. But my body was like, I don't really care about you being fat. I want your brain to work. And so it wasn't until the third time I got the procedure done that I actually started to notice, like, oh, the scale is moving. Because my body decided that's where it wanted to use it. I've had other patients where they're like, well, the symptom that I wanted fixed, I don't think it's being fixed. And I'm like, okay, well, let's look at your whole life and see if there have been any improvements anywhere. And usually they can find something. And it's like, okay, well, that's where your body wanted to use this. And the longer you're on it, the more things will be fixed. But again, can't guarantee things.
I love that. You know, sometimes it's better to get what you need versus what you want.
Exactly.
Right?
Exactly.
And then that does tend to fix everything else without you trying to just hit that one little area.
Oh, yeah.
So, okay, people always have concerns with the C word, cancer.
Yes.
So how do you address that? What is your conversation with that?
Okay. So the research that got a lot of people scared about cancer came out, and it was about synthetic hormones. So that's the one separation between what the biotech company is offering and what that research was on. That was on synthetic, man-made, or in some cases, horse estrogens and things of that sort. And since neither I nor you have ever been a horse, our body has to process that substance into a form that it can actually use. And that causes a buildup of byproducts.
Those are the synthetics.
Those are the synthetics. We don't have that problem with the bioidenticals because the hormone structure is identical to what your body naturally makes. So that's one thing. But the other thing, and this was the thing that cued me into how lacking my knowledge in this area was when I started. Back in 2017, it was the World Health Initiative study that got everybody scared. And before that, women were on hormone therapy. As soon as menopause hit, they were on hormone therapy. And for almost a decade and a half, we took women off of these therapies because, oh, there's a concern for cancer. Well, back in 2017, the woman that did that study, and she actually stopped it early because of, you know, so much cancer risk and heart attack risk and things of that sort that she was seeing, she actually went back and looked at the data and realized that she had interpreted the data incorrectly, and came out with an article in, I believe it was JAMA, but do not quote me on that. But it was an article back in 2017 that came back saying that the information was misinterpreted, that she was not correct in her initial study, and that even the synthetics did not great enough, it wasn't a great enough increase that it was statistically significant. I hate that word. But because of that, she came back and said, you know, hey, sorry, but that was in 2017 when the world was basically imploding. And so if that wasn't your field of study, you didn't know about it. You know, I occasionally have patients that come to me and they're like, well, I talked to my doctor and they said that, you know, this, that, and the other, and, you know, they're part of this organization that still says it's bad. And I'm like, well, I'm not your primary doctor. If you trust your primary doctor, that's perfectly fine. You do not have to get this done. But the newer research is showing that that is not the case, that there is no, that there is not an increased risk of cancer. Now, can anybody get cancer? Yeah, like for some reason right now, breast cancer is really prevalent. I'm not really sure if anybody's figured out why this is happening right now. But anybody can get cancer. But that doesn't necessarily mean, correlation is not always causation. So just because you're on the hormones does not necessarily mean the hormones caused the cancer that you have. And that's what, you know, all the research is being done. And that's one of the things that the biotech company does, is they're constantly in an effort of doing research to find out, are the products that we're offering actually working the way we expect them to work? Are we actually helping people out the way we think we are? Or should we shut this stuff all down? And thankfully, every piece of research that's been done is showing that that's not the case.
All right. How old do you have to be?
I would say I probably wouldn't work with anyone under like 27. I don't think I've had a patient that's under 27. But you can do this into your 60s, 70s, 80s.
Okay. Is there any reason why not younger?
Simply because, well, one, I don't think your hormones would be low enough to actually warrant it. At that age, because the research is showing that it's in the mid-20s that the females start to lower the testosterone, I would question why, if you were younger than that, your levels are so much lower. I would want to have that researched first, as opposed to just putting a Band-Aid on it. I would want to know why this is happening. As you get older, it's an expected response to getting older, but when you're younger, it's like, okay, well, why? I want to know the why before we start just doing things. But yeah, that's pretty much it. And then for guys, their testosterone tends to lower by about 1% every year in their mid-30s.
Okay.
So anything younger than that, I would question, okay, why is this happening? Can we figure that out before we do it? So it's not necessarily that I wouldn't do it, but I would always question why. And it's all going to be based upon your labs.
Okay. What if you had somebody who wanted to follow in your footsteps? What would be a book you would tell them?
Oh, that wants to follow my footsteps? Okay, a resource. I would say, right now I'm looking at the book, no, I know exactly what book. The Four Tendencies by Gretchen Rubin. It's this book about the idea that each of us has a propensity when it comes to internal versus external expectations. And figuring out what you are will help you guide your decision making. So I'm an obliger. Most people are obligers. Obligers have a hard time doing things for themselves, but are great about doing things for others. And in that, I've learned how to tackle issues. So when I wanted to get I was creating a little commercial for my website, and I wanted to get it done. And I had a patient that was coming in that is a graphic designer, and I got really excited about the idea of showing him this. Now, he had no clue that I was doing this. And if it were just doing it for me, then I could push it off to the side because it's not that important and I've got other things to do because it's about me. But when I made it about him, that meant that I had to get this done. I stayed in my office until almost midnight working on this, redoing the script, redoing the animation and things of that sort. I was using a system called Doodly. I wasn't actually animating. I can't draw. But I was doing this, and by the time when he showed up the next day, I was so excited to show him. But I was able to get that done because it wasn't about me, it was about showing him. Even though he had no clue to expect this, because I set up that expectation that I was accountable to him to be able to show him this on this day, I was able to get this done. And that's one of the cool things that you learn from this book is, you know, figure out what your tendency is, and then there are ways to harness that power in your tendency to do things that you wouldn't think that you'd be able to do.
Perfect. Well, thank you all for joining us today. That is our show. I'm your host, Leah Love, and this is Forum 360, where we have a global outlook from a local view. Have a great week.
Forum 360 is brought to you by John S. and James L. Knight Foundation, the Akron Community Foundation, Hudson Community Television, the Rubber City Radio Group, Shaw Jewish Community Center of Akron, Blue Green, Electric Impulse Communications, and Forum 360 supporters.